everyone, welcome back to the Parent Hub. I'm Lily, your go-to friend for all things new parenthood. If you're a fresh out the gate new mom or dad, I see you. Those first few weeks or months can feel like a wild mix of pure magic and total panic. One minute, your tiny human is staring at you like you're the center of the universe. The next, you're Googling, is this normal at 3 a.m. because of some quirky little thing they're doing? Trust me, I've been there. Heart racing over every twitch, sneeze, and weird noise. The truth? Most of those alarming newborn behaviors are 100% normal and just your baby's body figuring out life on the outside. Today, we're going super in-depth on the top 10 plus common newborn quirks that freak out almost every new parent, why they happen, why they're usually no big deal, and exactly when to stop worrying and call your pediatrician. This is the reassurance video you need right now. Grab your coffee or tea, no judgment, settle in, and let's ease that new parent stress together. Stick around till the very end for my top quick tips on trusting your instincts and some free resources to keep you calm. Hit play and let's dive in. Number 1. Jerky, twitchy movements and shakes, including the startle reflex. Hands flying up, legs kicking like they're in a tiny dance battle, especially when falling asleep, during sleep, hungry, or crying. This scared me so much with my first baby. It looks like a mini seizure. But here's the deal. Your newborn's nervous system is still under construction. The brain-to-muscle pathways aren't fully myelinated yet, so signals can misfire, causing random jerks, twitches, or the classic Moro reflex, arms fling out like they're startled. Super common in sleep transitions, feeding, or even just chilling. As the nervous system matures, usually by 3 to 4 months, movements get smoother and more purposeful. When to worry. If jerks are rhythmic, every few seconds, like clusters, happen when fully awake, come with stiffening, eye-rolling, lip-smacking, or don't stop when you gently hold the limb, record a video and call your pediatrician ASAP. Rare, but could be something like seizures. 99% of the time, just normal baby wiggles. Trust your gut. Number 2. Crying without tears, dry-eyed wails. Newborns cry. A lot, like ear-piercing levels, but no actual tears rolling down? You're not broken. This is 100% normal. Tear glands produce just enough moisture for eye health at birth. The extra emotional tears kick in between 1 to 3 months, sometimes 4 to 6 weeks for some lucky babies. It's one of those adorable mini milestones, like their first real social smile. When to check. If no tears by 4 to 5 months and other concerns, like dry eyes, etc., mention at the next well visit. Almost always fine. Number 3. Constant watery or goopy eyes, blocked tear ducts. Eyes always looking teary or crusty even when happy? Classic blocked tear duct. Happens in 1 to 5 to 10 newborns. The duct is narrow or has a tiny membrane from birth, so tears overflow instead of draining to the nose. Peaks in first weeks to 3 months, 90+% resolve by 12 months. Help at home. Gentle massage, inner eye corner down to nose, 2 to 3 times a day. Ask your doc for the technique. Warm compresses and clean crust with boiled or cooled water. When to see the doc. Redness, swelling, pus, infection, or still going strong after 1 year may need simple probing. Don't ignore infection signs. Number 4. Spitting up/reflux, the endless bib life. Milk dribbling out after every feed? Immature esophageal sphincter plus liquid diet equals easy backflow. Most babies spit up happily, no pain, great weight gain. Peaks 2 to 4 months, fades as they sit up more. When it's more, forceful or projectile, arching back in pain, frequent crying during feeds, poor weight gain, chat with pediatrician about GERD, feeding changes, or positioning. Number 5. Baby acne and other skin bumps or rashes. Red pimples on cheeks, nose, forehead around 2 to 4 weeks. Baby acne, super common in 1 to 5 babies, likely from maternal hormones or immature pores. clears on its own in 3 to 4 months, no scars. Also common, erythema toxicum, which is harmless red blotches with white or yellow centers, flaky or peeling skin, shedding womb layer, milia, tiny white bumps. When to worry. If infected looking, spreading wildly, or you're unsure, show the doc to rule out eczema or other rashes. Number 6. Misshapen or flat head. Cone head from birth, lumpy from molding, flat spot from back sleeping, all normal. Birth canal pressure, womb position, or delivery tools cause temporary shapes. Most round out by 6 weeks. Flat spots or positional plagiocephaly from too much back time. Prevent with supervised tummy time. When to check. Persistent odd shape or worsening flatness after 6 to 8 weeks, see pediatrician or PT. Rare craniostenosis, early skull fusion, needs early intervention. Number 7. Frequent sneezing, hiccups, and funny noises. Sneezing a ton, hiccups after feeds, grunting, snorting, squeaking while sleeping, all normal. Sneezing clears tiny nasal passages. Newborns are nose breathers. Hiccups from immature diaphragm multiple times a day, no biggie. Grunts and snorts from digestion, small airways, or clearing mucus. When to worry. With fever, fast breathing more than 60 per minute, retractions, flaring nostrils, persistent wheezing or grunting, or blue tint, call immediately. Number 8. Irregular breathing patterns. Fast breathing, pauses 5 to 10 seconds, then quick bursts. Periodic breathing, super common as lungs and respiratory control mature. Noisy congestion from narrow passages. Red flags, pauses more than 10 to 15 seconds, grunting with every breath, chest retractions, blue lips or skin, emergency. Number 9, mottled skin, marbled look. Pink, red, purple marbled patches on legs or arms, normal in newborns. Immature circulation and thin skin, goes away when warmer or older. When concerning, persistent blue tint, especially lips or tongue, or with breathing issues. Number 10, mild jaundice, yellow tint. Yellow skin or eyes starting day 2 to 4, very common, liver maturing, clearing bilirubin, usually peaks week 1, fades in 1 to 2 weeks. When to worry. Appears in the first 24 hours, very deep yellow, chest, legs, or arms, sleepy or lethargic, poor feeding, doc checks bilirubin levels to prevent issues. Number 11, crossed eyes or wandering eyes crossing or not aligning, eye muscles still developing, normal first 2 to 3 months. When to check, persistent crossing after 3 to 4 months, may need eye doc. Whew. That's a lot, but you're not alone. Most scary newborn stuff is just development in action. You're doing an amazing job noticing these things. That's great parenting. Always trust your instincts. If something feels off, record a video, note details, and call your pediatrician. Better one quick call than endless worry. Want more calm? Comment below, which quirk freaked you out most? Subscribe and bell for weekly Real Talk tips, and check the description for my free Newborn Milestones Tracker PDF. It'll help you know what's next without the stress. Thanks for hanging out with the Parent Hub. You've got this, mama or dada. See you next week. Big hugs. Take care.